Several countries around the world have put in place multiple interventions aimed at curbing the spread of COVID-19, from social distancing to travel restrictions to massive lockdowns. These non-medical interventions, given the lack of a vaccine, have managed to considerably ease the burden on a country's healthcare system, and in many cases flattened the curve of transmission altogether. The Imperial College of London, in a recent study, has managed to infer the impact of these interventions across 11 European countries. The study suggests that strong social distancing measures aimed at slowing the spread of the virus across Europe were estimated to have averted thousands of deaths. From isolation of confirmed and suspected cases to closing schools and universities to banning mass gatherings, and most recently, wide-scale social distancing, including local and national lockdowns. Such interventions were aimed at managing the epidemic in many European countries to prevent an unmitigated rise in the number of cases and overloading healthcare capacities. The latest modeling shows that these measures may be having a significant impact, potentially averting up to 120,000 deaths across Europe. However, the study adds that the estimated portion of people who have been infected with the virus may only be between 2 to 12% of the population. Nonetheless, the results were significant for governments to consider extending or maintaining existing interventions. The study used real-time daily data from the European Centre of Disease Control on the number of deaths in 11 European countries: Austria, Belgium, Denmark, France, Germany, Italy, Norway, Spain, Sweden, Switzerland, and the United Kingdom. In the case of France, Germany, Italy, for instance, Germany was one of the first European countries to put suspected cases in self-isolation. On the 5th of March, Germany mandated self-isolation, while Italy and France began advising self-isolation on the 9th and the 17th of March, respectively. Italy was, however, one of the foremost European nations to encourage social distancing on the 9th of March. Germany and France mandated it on the 12th and 17th, respectively. Italy was also one of the first countries to ban public events, while France wisened up on the 13th of March and Germany much later on the 22nd of March. Lockdowns were mandated by Italy on the 11th of March, while France issued lockdown orders on the 17th, and while Germany did much later on the 22nd of March. In addition to reducing deaths, the latest report estimates that between 7 and 43 million people have been infected across all 11 countries up until the 28th of March, representing between 1.88% and 11.43% of the total population. However, it may still be too early. The researchers warn that to conclude whether recent infections have been effective, more study is required, since there is a time delay of 2 to 3 weeks between when transmission changes occur and when their impact can be observed. Researchers say it is critical that the current social distancing measures remain in place and trends in cases and deaths are closely being monitored in the coming days and weeks to provide reassurance that transmission of the virus is slowing.